Kalispera. First of all, apologies that I can't, unfortunately, talk to you in Greek this evening, but huge thanks for inviting me to be part of this really special occasion this weekend. So, as per my introduction, I've been a doctor for over 20 years now, and I've been a consultant in paediatric emergency medicine at Imperial for over 10. And I've had the privilege of complementing my clinical practice by leading work across our organisation to also be building improvement and innovation into everything that we do. So Imperial is a large provider organisation in northwest London. We have 5 different hospital sites delivering care across all of the medical and surgical specialties for all ages. We manage nearly 1.4 million patient contacts a year, including a very busy emergency departments, which I can attest to when I spend my Monday evenings in there. And we serve a hugely diverse population. Northwest London, of which we are one of 5 providers, although we're the biggest trust, has a population of 2.7 million people. We also have huge health disparities in our sector, with an 18-year life expectancy gap in one small geographical part of the part of London that we serve. And we employ a big 16,500 staff of hugely diverse backgrounds across all disciplines and professions, as well as diverse backgrounds culturally. We also have a private healthcare division within our organisation that delivers care both to local and national and international patients across all of our sites. Perhaps the most famous department of which is the Lindo wing, pictured here, where some of our royal babies have been born over the years. And all of the money, importantly, all of the money that we make from our private care gets reinvested back into improving both the provision of care through our private services and our publicly funded services as well. And we're particularly proud to have launched an international affiliate network through our private care division in the last few years. And it's been providing us with a really unique opportunity to collaborate with leading healthcare organisations globally. We're particularly excited to be in an affiliation with the Athens Medical Group, our first in Europe, and the opportunity for shared learning, innovation and collaboration that's going to bring us, because our values are very much aligned in how we can enhance care together better for the populations that we serve. You'll see from our strategy and our vision that actually a lot of our values are truly aligned. We also are striving to deliver high-quality integrated care and outstanding services that are truly patient and user-centred. And we're doing lots of work as well to make sure that we build learning, improvement and innovation into everything that we do as an organisation. And through our affiliation with your organisation, we will really enkindle the values of being collaborative and aspirational in achieving high value for the patients and populations we serve. So this evening, I just wanted to spend a little bit of time giving you a brief overview of some of our approach to innovation across Imperial Healthcare Trust. We've put a real focus in recent years to leveraging the assets across the healthcare innovation ecosystem so that we're moving from working in silos rather than to work in systems. We've recognised that by working with key partners, both nationally and internationally, that we can really improve the value of the care that we can provide together for those we're serving and treating. At Imperial, we've got innovation happening across all parts of the innovation pipeline, from early research and ideas being generated addressing some of the challenges that we face, through testing transferability and feasibility in real-world environments, to also the adoption and spread. And we're well placed to do it because of the diverse population that I've talked to. And it's important to us that we do our research reflective of the populations that we're serving. And we've got a hugely talented workforce as well, who are aspirational in the way that they're seeking to improve their own services. We also have lots of academic expertise. In fact, a lot of our colleagues have joint contracts across Imperial College London and also the Trust. And we've cultivated implementation science and improvement expertise over recent years as well. Through close affiliations with Imperial College London and also our Health Innovation Network, we've been really fortunate in cultivating lots of expertise in this space. Our charity have been an important player. Obviously, as a publicly funded organisation, money can be tight, but the charity have funded in the last 4 years through an Innovate grant programme, 42 staff-led innovation projects, totalling £2.85 million, which has really led the way for some of our services. We also hold the largest biomedical research grant in the UK, which we're very proud to have achieved, and all of the different work streams we span 14 different themes in our work streams, and we're really proud and passionate about transferring that research into real life changes for our patients as quickly as possible. And we've been proactive as well in making sure that all patients have an opportunity, should they wish, to be involved in research. And we have managed to achieve an impressive amount of clinical trials, recruiting huge amounts of patients over recent years. And like I said, it's so important to us that we are equitable in all that we do as an organisation. So we've been leading work as well to ensure that we are providing opportunity for proper diversity in these trials to be properly representative of the populations that we're serving. So we've got plenty of examples of innovation happening across our organisation, and I'm just going to flash a few up here, from cutting-edge virtual reality that's improving both consultations with patients and training for staff, as well as a rapidly translated gene editing therapy that is really leading the way in enhancing the lives of our young people with sickle cell and thalassemia, led by one of our paediatric haematologists. And as somebody who's looked after this cohort of children in my more junior years, I'm very excited about the impact that this can truly have for these people's lives. And also we've got good examples of early adoption as well, such as taking on this obesity treatment with progressive surgery. There's some really nice examples of staff-led innovation that are starting to genuinely show value too. This piece of work was led by a couple of our neonatologists who recognised a need for parents to be more proactive in the care of their babies on the unit. Though it's not bringing in a handsome financial return, a modest one rather, it is, however, bringing huge value to families in our own neonatal unit, and actually has been spread across lots of different healthcare organisations in the UK and beyond, and has been recognised by national awards. And in fact, only the other day, another of our teams was awarded a national award for the implementation of a wearable device to detect obstructive sleep apnea, and integrating it into a pathway of care, again, sort of demonstrating the value that we've got by working within an ecosystem of innovation with researchers, testing things on the front line and transferring these into clinical practice. One particular strand of our ecosystem building that we're particularly proud of is Paddington Life Sciences. In one of our sites, St Mary's Hospital sits in the Paddington Basin, which when I was first a junior doctor in that site 20 years ago was a bit of a no man's land. And actually one of your colleagues talked about dead bodies being found in the canal at times. But actually it's now a really thriving and burgeoning ecosystem with lots of industry coming in. And we recognised the opportunity a couple of years ago and so set up a partnership to really cultivate a life sciences venture together. And you can see all the different partners that span pharma, medtech and other industries. We're working together on lots of different priority areas as a partnership, including social value. And a really great piece of work that happened this year was mapping life sciences skills that industries need and working with some of our local schools to start to think about how we train people who live locally in the community to do those jobs and therefore to further cultivate the industry and the ecosystem. And another thing that's coming out of this venture is something called the Fleming Centre, which you might have heard about. For those of you that don't know, Alexander Fleming discovered penicillin on St Mary's site in 1928. And as he predicted when he found this finding, we're obviously globally quite concerned about antimicrobial resistance. So as we approach the centenary year, work is afoot to develop the Fleming Centre. The sort of quite tired, sad-looking white building on the bottom is actually where our executives live in Imperial. But that's going to be transformed into the Fleming Centre, which is going to bring together frontline staff, the public, along with policy, government, both nationally and internationally, and obviously cutting-edge research to really address this challenge. And we're super excited and proud of the fact that having this view of moving from silos to systems and thinking about our innovation ecosystem has helped a lot of this work happen. Not least, of course, supported by Lord Darcy's great fundraising with philanthropists to enable this to happen. So my role as a consultant who's on the shop floor in A&E a lot of the time is to make sure that all of this exciting work that's out there happening isn't just for the academics in our organisation, but actually is open for everybody to build innovation into everything that they do. And so we've been developing a strategy to make that possible. We're trying hard to make innovation integral to how we run the organisation, particularly by helping our staff develop an aptitude for understanding and articulating the problems we're facing and really being curious about things that we can do to address them. We're building capability and capacity for innovation through training and fellowships and embedding it into our existing roles and routines. And we're doing work to streamline some of the processes and systems that staff are telling us are getting in the way at the moment. But importantly, we're pulling the health innovation ecosystem as close as we can to the front line and playing an integral part as a connector and forming deep partnerships both within our own local ecosystem in the UK and London, but actually really excited about the opportunities that working with your group is going to bring to that as well. So, Efaristo. Thank you.